This is Michaela Shoup with St. George News. I'm here today to talk with local dermatologist Dr. Stephen Piney about who is at risk and what the treatment and prevention options are for skin cancer. Thanks for sitting down with me today. So who is at risk of developing skin cancer?
Well, everybody's at risk for developing skin cancer. The people at most risk are those who have light skin, particularly people with really light hair, red hair, freckles, light blue eyes, and then those that have lived in sunny climates, who've had a lot of sun exposure throughout their lives. The other big risk for developing skin cancer is if you've had sunburns as a younger person. You know, people who've had a blistering sunburn have twice the risk of getting skin cancer as anybody else.
And how can people protect themselves from getting skin cancer?
Well, the best way to protect yourself from getting skin cancer is to protect yourself from the sun. You know, it's well established that the sun causes skin cancer. The ultraviolet rays of the sun damage our DNA and can cause mutations that lead to skin cancer. So protecting yourself from the sun is the most important thing. Wearing a hat, wearing sunglasses, and wearing sunscreen. You know, long sleeve clothing is important as well if you're going to be out midday. The other thing is just to try to avoid the sun. You know, not being out in the middle of the day. A good rule of thumb is to try to only be outside when your shadow is longer than you are tall. That's in the early morning or in the evenings. That can protect you from the sun.
And how do you go about diagnosing skin cancer?
Skin cancer is diagnosed by biopsy. Traditionally, we do skin exams where we check the patient for any signs of skin cancer, and if we find a suspicious lesion or find an area that we're worried about, we'll do a biopsy. We'll numb the area and take a small piece of the skin and then send that to the lab for analysis to see if it is skin cancer.
What methods do you offer at Vivida to treat skin cancer?
My main source of treatment for skin cancer is Mohs micrographic surgery. I'm a fellowship trained Mohs surgeon, and I try to focus on skin cancer on the head and neck and sensitive areas. If Mohs surgery is not indicated, which it's not in all places, then we will do excisions where we just cut the skin cancer out, send it off to a lab. Also, there's a burning and scraping procedure called the electrodesiccation and curettage, which is where you simply scrape the cancer away. Skin cancer can also be treated with topical chemotherapy in some cases. In special situations, if needed, we can use radiation and send the patient to a radiation oncologist, and they can treat it with radiation.
Thank you, Dr. Piney, for meeting with me today. To learn more about skin cancer prevention and treatment options, or to make an appointment with a dermatologist, visit Vivida.com. This has been Ask the Local Expert with St. George News.